Good evening, everyone, and welcome to my YouTube channel, Pain Free Partha. Today, I'm going to talk something about a very short video only about Coanda effect. So sometimes my concept may not be acceptable to some people, but whatever I want to say, I will try to stabilize by scientific evidence. Okay, what is it? Henry Coanda was a Romanian engineer. Okay, he was the inventor, aviation pioneer. Okay. So Romanian engineer who found out the Coanda effect. Now what is it? It is a tendency of a fast moving fluid. Okay. And there is a curved surface. And it flows to the curved surface and goes towards the curved surface and not directly like this. So a high speed or a jet follows a curved surface instead of continuing a straight line, creating a lift or a deflected flow. This is what is called Coanda effect. The Coanda effect is a fluid dynamic phenomenon in which a moving jet tends to attach and follow a curved surface rather than flying. This happens because the jet also entrains surrounding fluid, creating a lower pressure beside the surface. So it difference pulls the jet towards the surface. So maybe some part of Bernoulli's principle we can see in the previous videos. I can see very simple clinical examples. You can see in supravalvular aortic stenosis. There's an aortic valvular stenosis. The jet is like this. In supravalvular aortic stenosis, there is a bulge and this directs to this here. This is the problem. That is sometimes a pulse may be good in this arm and not good in this arm. Asymmetric blood pressure, that is very characteristic of supravalvular aortic stenosis. That is because the jet follows the curve. That is Coanda effect. Now we can see aneurysms and even clipping. Now we have an aneurysm here. Okay. And this comes in and jet falls and goes like this. There is one more problem. Now we have an aneurysm is clipped and the bulge is here. Sometimes the clip causing bulge here and or a bulge here, the jet will touch the curve and go like this. So aneurysms can cause problems to flow direct the flow towards a path, or even clipping can cause because of the Coanda effect. There's a small bulge and it goes flex and goes towards that side. In patent ductus arteriosus, now you can see from the aorta it is coming like this. And the curve also goes towards this side and not this side. So we can see the jet goes impacting flow dynamics within the pulmonary arteries, exacerbating the left lung problems. Sometimes the jet is flowing towards this. Coanda effect as an explanation for unequal ventilation of the lungs even in normal positioned endotracheal tube. Now we know the endotracheal tube has gone in one lung is ventilated. Even if your tube is correct in position, sometimes the Coanda effect may see because here there may be that here you can see the tube's mouthpiece can be here, the opening can be here, and it touches this and goes like this. So the opening can be here and it touches this and goes. That is an advantage of putting the cuff and centralizing the tube and just rotating the tube, an appropriate size tube and a mid-tracheal tube. Or sometimes what happens is there is a small mucus plug here. The air comes and the mucus plug just redirects the major flow into this direction. So you may get a decreased ventilation even though your cuff is proper, your endotracheal tube is proper. This is because of the Coanda effect caused by a small mucus plug at the just above the carina in the trachea. The Coanda effect also describes how eccentric mitral regurgitation jets, eccentric mitral regurgitation jets and goes to the left atrial wall. Slides like this. The eccentric left atrial goes so that when you see in the echo, it will look like a mild MR, but it is actually the severe MR. That is because of the Coanda effect. Jet Cling to the left atrial wall. Size and severity to be underestimated on echocardiograms. Now you see when the blood vessel is bifurcating like this, okay, a small atheroma is like this, and the blood flow just can go this, a fast flowing and a reduced blood flow. Yes, a jet ventilator also can cause, because of the thick mucus or bloods, it can be directed here. Now we go to pressure triggered cycling. All these things are happening. What I want to tell is fluid logistic ventilators. Now completely electronics have completely dominating the system. So this is about fluid logic ventilators where there is a small pressure increase in the lungs. Directs the jets towards so that the expiration goes like that. Okay, to the exhaust. This is how increased pressure in the lungs as the patient exhales. Okay, this is a small increased pressure which directs the jets towards the exhaust. This is about in pressure triggered cycling. During ventilation via tracheal tube in a bronchoscope, yes, it can be directly towards the one wall of the trachea. It can hit on this and the side port of ventilation. This is the bronchoscope. I will now tell here. You can see here it is towards one lung. I will give one more picture here. Now you have a bronchoscope and the jet is given here. Okay, we are visualizing this. Now if the jet is here, fine, everything is there and it will resisting air, goes out air is fine. But the jet is here, it will cause problems in visualizing, and the jet may hit the wall and goes like this. And if the jet is here, it will hit the wall and goes like this. So that is why the correct position of the jet should be there when you start to ventilate or use an bronchoscope and a side port jet ventilation. So what is Coanda effect? To summarize, when there is a bulge, when there is an obstruction, it goes on and goes like that way, the jet. Unequal ventilation, jet ventilators, bronchoscopes, aneurysms, plaques, and supravalvular aortic stenosis. Mitral regurgitation, the severity will be less shown because of the eccentric jet. All these things are clinical examples. Ventrain is not exactly Coanda effect. I will discuss this in a different video.